Good morning, everyone. Hi, my name is Andrew Turan, and I'm a fourth-year medical student at the Tulane University School of Medicine. Today, I'll be walking you through my project, Risk Factors of Dissection Cellulitis of the Scalp, a Case Control Study. So dissection cellulitis of the scalp, or DCS for short, is a debilitating chronic inflammatory condition that primarily affects our patients of color. And as you can see in the patient picture, it is characterized by suppurative nodules, pustules, draining sinuses that can eventually lead to scarring alopecia on the scalp and give our patients a negative or poor quality of life. DCS is associated with hidradenitis suppurativa, pilonidal and acne conglobata as part of the follicular occlusion tetrad, and they are hypothesized to share similar pathophysiology. Studies have shown a strong correlation with obesity and smoking in HS patients, which leads us to consider, since DCS and HS share similar pathophysiology, they may share comorbidities. And our objective for this study is to answer the question, is smoking and obesity associated with a diagnosis of DCS? And we wanted to characterize these clinical characteristics with this disease. We did a case control study via a retrospective chart review and had 33 DCS patients that served as our cases and 304 keloid patients that served as our controls. We included patients with a diagnosis of DCS or keloids and excluded any patient with a concomitant diagnosis of any of the other diseases that were part of the follicular occlusion tetrad. Demographically, there was no significant difference in terms of mean age or race between our cohorts, but we did find significant difference with regards to gender, where our DCS cohort was predominantly male versus our controls, which was predominantly female. When looking at smoking, we did find a significant difference between the two cohorts, but we did not find any significant difference with regards to mean BMI or BMI subgroups. With our statistical analysis, we found a significant correlation with current smoking status with a diagnosis of DCS with an odds ratio of 6.47, but did not find a correlation with regards to former smoking, overweight, or obese status, and this was after conducting a regression analysis that adjusted for age, race, sex, smoking status, or BMI. So what our study suggests is that DCS patients are almost 6.5 times more likely to be current smokers with no clear correlation with obesity. And this strong association with smoking should encourage physicians to promote smoking cessation as part of a treatment plan when treating patients with this debilitating and chronic inflammatory condition. I'm happy to share that our paper was recently accepted for publication in the Journal of American Academy of Dermatology. So if you'd like to see our project in its fullest, I would encourage you to take a look at our paper. And of course, thank you to Dr. Marina for her mentorship and the DeBakey Scholars Program for their support. And I am very excited to see you all virtually at the Health Sciences Research Day on April 15th. Hope to see you there.